Yes, I think it's dialing up. Thank you, guys. Okay, so we're waiting for Dr. Jonathan to come back on.
Hello.
Excellent. Hello, doctor.
Hi, how you doing?
Yes, I'm sure you understand what it feels like with all of these technical issues.
Yeah, no problem at all.
Floating up. Thank you so much for doing this. Thank you for joining us.
Yeah,
Guys,
thank you for
I
having me on
want
the
to
show.
also mention that Doctor is a frontliner. So he is among the heroes of this time, fighting for us in the front, which is the health sector. And having him here is actually very, very, I mean, we can say thank you so many times, but that may not even be enough because he has taken out this time to be here, you know. So, Doctor, thank you so much for joining us. I'm sure the request is going to be going out again, so we're going to have people rejoining in. Like I said, we have so much to discuss today. So I have already, I've tried to introduce you, but could you please tell us a bit more about yourself as we just get started?
Yeah, so thank you for having me on the show. It's an honor to be here. So I'm a consultant urologist. I work in London. I'm my father's Nigerian from Ibadan, and did my schooling initially in Nigeria and then came to UK for my high school and medical school. So I'm a consultant urologist. I work in a large hospital in London. For your listeners that don't know, urology specializes in, we see women as well as men. So the urinary system, so men with erectile problems, bladder and waterworks problems, kidney problems, and fertility as well. So male fertility, we see it, which is a big problem as well. So we do see majority men, but we see a lot of women and children as well in urology.
Children?
Yes.
Wow. Well, it's excellent too, actually, because to be honest, the first time I had urology, I kind of had an idea, but I had to go back and research it. So I'm sure this is an important thing. People will be like, okay, what is it? Who is he actually, apart from being a doctor? Guys, in a nutshell, he is a doctor that specializes in everything that has to do with health that goes with your genitals, really.
Correct, yeah.
Right?
And urinary system, correct.
Yeah, and your urinary system. So he is one of those rare doctors that, you know, you need to search for when you are like in hook need. So, doctor, again, thank you so much for being here. We're going to get straight into it. Like I said, I have questions that have been pre-sent. And we're going to just start out by asking the first question, which is, why is men's health important?
Well, yeah, this is a really, really important question, and one that I'm very passionate about. Normally, you know, we have International Women's Month, where women have a lot of things on cancer and women's disease, which is absolutely fantastic. But men get one day, Men's Health Day, which is in October. So it just shows that exactly, one day in November. And in terms of things like prostate cancer, so prostate cancer is now the #1 killer in the UK in men. And it's a big, big problem in Nigeria. The number of men I see diagnosed with prostate issues or prostate cancer is rising exponentially. So it's something that really needs to be discussed. Unfortunately, men bury their head in the sand when it comes to health, and they come and see me when things are hanging off or dropping off. That's when they come and see a urologist. Otherwise, they'll suffer in silence and say absolutely nothing to their loved ones or friends. It's just a taboo subject men do not like talking about. So I'm here to break that myth.
To be honest, when I came up with this whole conversation and this whole, should we have this as one of the conversations we're going to have live, it was a lot. I had to ask my husband, I had to ask my brothers. I was like, what do you think men will come forward? And to be honest, what is actually interesting is that most of the questions that were asked were women. You know, they asked on behalf of their husband. But, you know, I understand the area of, oh, yes, let's go. I want bigger, I want longer, I want long lasting. Yeah, that's a place you're like skeptical men wouldn't want to come. But what about the thing that has to do with health? How about talking about prostate cancer and how much it has killed so many people? You know, so it's an important area to actually really talk about. So we're going to go straight into the second question is, from what age should men start to pay attention to health as general?
I'd say from early age. You know, I've got a young son now and I teach him that health is wealth. It's really important that if you don't know what normal is, how do you know when things are not normal? I'll say it again. If you don't know what normal is, how can you know what's abnormal? For example, I see a lot of men with testicular cancer. So that's cancer of the testicles. And often it's diagnosed by self-examination. So the man has to be shown or know how to examine his testicles in the shower once a month. But a lot of men don't know that. So when things are changing, they have absolutely no idea there's a problem. And a lot of the time, actually, we know there's a problem when their partners identify a problem with the testicle, maybe not the man themselves, which is not a good way of doing things. If you imagine, women are always taught to do self-examination of breasts, and it's very well known. A lot of men have no idea what to examine, how to examine testicles. It's a very common cancer in young men, but it can be cured if treated early.
So this is very similar to women having issues with breast cancer. Yeah. Because I actually was involved in a whole movement on breast cancer about 2-3 years ago when I was working with a different company that tried to dedicate, the month of October, I think that's it, to women. And we gave out, there was a lot of movement, there was a lot of noise. We went out in the streets, we gave out test kits. So indeed, women actually have a lot more. You're told early, every month, check yourself. But I didn't realize that men, doctor, can you hear me? It looks like your internet is going off now. Is it my internet or doctor's internet? Guys, if you can hear me, please give me a wave. Okay, doctor, I was thinking it was me or you. So women are told every month to do this, and men aren't told. And this kills men as much as it kills women.
Correct.
Why do you think there's that? Why do you think people are not really coming forward to talk about these things?
As I said, I think it's a taboo subject. Men's health has really not hit the headlines. There's a lot of women have pink marches, pink days. Women are very engaging in health. But unfortunately, men have worse outcomes because we just don't want to see a doctor. And often it's when things are at the last edge is when they come and see me. And often it can be too late. So we're just trying to send that message to men, especially the men out there and the women of the men, to say, get your men to seek medical intervention early. Let's get talking about men's health as a natural topic, like we do for women's health, and we can save some lives.
Wow. Okay, so let's start to get deeper into this conversation right now. The first real question that I feel that is more towards the topic is, what is erectile dysfunction?
Yeah, so erectile dysfunction is a condition, and the medical terminology is insufficient erection, erection that's not sufficient for penetration or sexual activity. That's the basic kind of, if you Googled it, this is what you'll find. But in practical terms, it means that any man that feels that his erection isn't what it should be, which is pleasurable for sexual activity. So I'll give you an example. Typically, I see a man in his 40s who over time has had problems with erections. I normally go by erection strength. So I say to men, if 100% is when you're a young man and things are going well, what percentage of your erection now? And they say to me 30, 40, I've had 10%. So I try and go by percentage in terms of the strength of erection, and is it sufficient for penetration or sexual activity? And so erection dysfunction is when there's a breakdown in that, it doesn't work for whatever reason.
Wow. Please, I'm going to take you back one question because it kind of tied into what we were discussing before. The question popped in while we were speaking. I mean, for women, you're told raise your hand above your head, touch the size of your breast to notice if there's any lump. Someone just asked, how do men actually test the testicles to find out if there's a problem?
Okay, that's a very good question. I'm not going to give you a live demonstration. I think people would shut off the screen if we did that. But imagine you've got the testicles here hanging. Right. What we say is in the shower, you use both hands and palpate the testicles. So you've got the ball, which is the lower part here, gently the top part here, and the middle part and the top part. And what you're feeling for is anything that's abnormal. Does it feel firmer than normal? Does it feel very hard? Is one side significantly bigger than the other? Is it painful? It's obviously not very great, but is it more painful than normal? So these are telltale signs that there could be a problem, especially if the testicle is getting rapidly larger. That could be a problem. You need to seek medical intervention. Wow. But if you don't know what normal is, how would you know when things are changing? That's what I say to men all the time.
Yeah, that's actually, which is, again, similar to the women. So what is inside is like there's a growth, something growing inside. So it gets bigger than normal.
And firm as well, hard.
It feels more firmer, like harder than it. So it's cancer.
Yes, potentially. So
potential cancer.
Correct, yeah.
Okay, so thank you for that. I hope your question was answered. Now, and going back, you've asked what is ED, that's erectile dysfunction. Now, how common is this amongst men?
So yeah, in men over 50 is extremely common. That's the highest range that I see them in. We're starting to see more men in their 20s and 30s presenting erectile dysfunction. So if I explain how erections work, that might give your viewers a bit more understanding. So imagine you've got your testicle is basically full of two cylinders on each side. They're called the corpora cavernosum. And during sexual arousal, these blood fills in the cylinders to give an erection. Once you finish your business, the blood leaves the cylinders and you're flaccid. So anything that interrupts the blood getting into those cylinders can cause erectile dysfunction. Are you with me so far?
100%.
Yeah,
That's
but erections aren't just about the physical; they're also the emotional. So that's why if men are tired or had a long day at work, or there's an upset with your partner, things don't quite pop off as you wish they should do. But imagine from the mechanical point of view, there's a disruption in blood in those cylinders. So, for example, I'll give you an example. If you have a heart attack, the small blood vessels in the heart get blocked up, and the heart doesn't work again. The same thing can happen in the penis. So the tiny blood vessels can get blocked and you can't get adequate blood flow in the penis. And that's what causes erectile dysfunction. I'll be very clear in what I'm saying next. If you get erectile dysfunction in the age of 50, it could precede a heart attack by about 10 years.
Oh my God.
No one knows that I say that the penis is a window to the heart. I'll say it again, the penis is a window to the heart. The same processes happen in the penis can happen in the heart. That's a heart attack. If it happens in the brain, that's a stroke. It's just that the penis is very sensitive. So whenever I see a man in his 50s who's got new onset erectile dysfunction, I'm telling him you must get a cardiovascular screen, so your cholesterol, blood pressure, and go and see a heart doctor. It may save your life. Absolutely.
Can you imagine? This is actually really deeper than you could imagine.
Absolutely.
This is quite deep.
Yeah.
Now, what would you say is the main cause of this, really?
So in older men, so when I say older, obviously a man in his 50s is still young, but we try and go above 50, over 50. Older men, it's due to the same blockage. So now I told you about blockage of blood vessels.
That's right.
You get a buildup of cholesterol, so the fat that blocks these very fine blood vessels, reducing the blood flow into the penis, basically. So what can cause that? Lack of exercise, poor diet, eating too much gari, ground rice, eba, things we like to eat, but they can clog your blood vessels in the heart, in the brain. That's why so many Nigerians have stroke, have cardiovascular disease. And erectile dysfunction is one, but it's underreported. So men do not talk about this. So it's not picked up. And hence, you know, we don't have the opportunity to save lives and understand and explain to people. So that's the one mechanism. So in older men, it can be due to blockage, cardiovascular. Sometimes it's due to nervous supply. So erections are very complex. It's not just about the physical. There's emotional and nervous supply as well. So if you had a surgery to the prostate area, you can cause erectile dysfunction. So as a surgeon, I remove someone's prostate gland, and a side effect is erectile dysfunction because you're damaging the nerves intentionally, well, not intentionally, you're damaging the nerves around the prostate and the penis, and that can cause that. In younger men, so when I see men in their 20s or 30s erectile dysfunction, it's very rarely due to mechanical or blood vessel. It's often to do with emotional and emotional issues. So we see a lot of men with anxiety about performing in front of their partner, and that just causes, and they get problems. Yeah, absolutely. Men have anxiety. So I say to a man, I see him with their partner that they have erection problems. I say, we both have busy jobs, things don't work as they should do. I say, whenever you go on holiday, what's your activity like? Oh, it's fantastic, it's brilliant, we have the best sex ever. And that tells me that it's not just about, it's about situational anxiety. So you're on holiday, you're relaxed, no kids, no family, no stress, no wahala, and things are great. But at home, when there's family, stress, jobs, money, anxiety, alcohol, this can all affect your sexual health, basically.
You know, I was just about to ask you that question, actually. I was going to say, are there drugs we take? You know, normal Nigerian, we just pop a lot of drugs in Nigeria. I mean, like Panadol, for example. If there's something like abuse of paracetamol and Panadol, I think that's a thing in Nigeria. So yes, things like that, and lifestyle. So does it tie into these things? So drinking, smoking, the need for exercising?
100%, absolutely. So again, I'll use the analogy of blood vessels. So imagine our bodies are like a Ferrari sports car, a fine Ferrari, well-tuned engine. If you take that engine and put it in the middle of Lagos traffic, what's going to happen to that car? It's not going to move very far. It's going to go very slowly. And years of putting that Ferrari in Lagos traffic will damage the engine. The
That's
engine
right.
needs to open up. It needs to go in an expressway. It needs to speed up. So what I'm trying to get is exercise. You need to basically exercise to open up your engine, open up those blood vessels, and get blood pumping around the body, number one. Number two, the fuel you put inside the car. You don't want cheap nonsense fuel from down the pipe. You want the premium A-grade fuel. You want your body's a temple, so look at the foods you eat. You want things that are low in cholesterol, in the bad type of cholesterol called LDL cholesterol, and high in the HDL cholesterol. So that's a good cholesterol that mops up all the bad cholesterol and helps prevent blockages. You want your mental health to be good as well. If you're calm and peace, then that helps with erections as well, and it helps all this. So everything's interchanging in a complex way to try and include your health.
Wow, this is quite insightful, honestly.
Did that make sense? So I wanted to make it specific by saying I was in Nigeria a few months ago, and Lagos traffic is horrendous, and I thought if you had a sports car in that traffic, that car's not going to move. The engine will damage.
Explanation. Yeah, that's an excellent way to actually tell it and just explain it. So if you have someone with erectile dysfunction and approaching you now, what would your treatment approach to this kind of thing?
Well, firstly, I need to ask them, what do they mean by erectile dysfunction? A lot of people Google things, and some guys say to me, oh, well, doctor, when I'm with my partner, I don't satisfy long enough. I'm like, how long is long for you? He says, oh, 30 minutes. I'm like, that's normal. 30 minutes is normal. There's a condition called premature ejaculation where men finish too quickly, and that's defined as ejaculation within 60 seconds of penetration or activity. That's premature ejaculation. A man who says, oh, I can't satisfy my partner for 30 minutes, that's normal, you know? So the medical term is less than 60 seconds after penetration, you ejaculate. That's seen as premature ejaculation. That's a medical problem. And, you know, yeah.
Wow. We're going to get to that anyway. Now, so you can say that this case shows up at what age? Would you say only 50s, 60s? Do you find it in younger men? Do you find it rising in younger men? And what's the youngest age you've actually encountered?
So I'm starting to see erectile dysfunction in men of all ages now. And the youngest I've seen was an 18-year-old man, who 18? Said he had problems with his 18, yeah. I think the problem is a lot of people, some people watch pornographic material. I'm not judging them for that, but it sets really abnormal expectation in how a man should be. You know, they watch these guys who are going for hours and hours, and then in their mind, mentally, they think that's how things should be, basically. And it can really cause anxiety in some men and stress, and then that can play on their mind. And then every time they have sexual activity, things don't work. For those men, drugs do not work at all. The number one treatment is actually called psychosexual counseling. It sounds mumbo jumbo, but actually what it is, you sit with a psychosexual counselor with your partner. You can't do it alone. The two of you have to be together. And they talk about issues in the bedroom, techniques, how things are doing. It gets quite emotional and deep, basically. And it tries to debunk the issues that the man's having the woman and the woman's having the man, or vice versa. And that's the most effective treatment for erectile dysfunction in young men when you've proven there's nothing mechanical wrong with the cylinders. Right. In older men,
so then it's emotional, correct, and it has a lot to do with person-to-person approach to wrong information, you would say.
Correct. Yeah. And different expectations.
And for an older person who you actually determine that this person has a problem, are there medications? Do you actually go into surgery?
So the first stage after taking a history and examining men is medication treatment. A tablet called, your listeners may have heard it, Viagra. So these are called PD5 inhibitors. And what they do, remember the cylinders and the blood vessels?
Right.
They relax the blood vessels in the penis and allow more blood to rush in to give a more sustained erection. They last for about 2-3 hours, and they take between 15 to 30 minutes to work from the minute you take the tablet. So tablets like Viagra, which is very common, or Cialis, which is another one I prescribe. And you have to take it normally about 30 minutes before sexual activity. For some men, they don't like to take a tablet and then romance their partner. It's too much for them. So sometimes we give a tablet where you take a small dose every day, and it keeps the levels in your body constant. So when you're ready to go, it gives you an erection immediately, basically. If some men tablets do not work, so they've got really bad diabetes or blood pressure where the tablets are not working. In that situation, the next thing is an injection. So it's like a small diabetic needle where you inject the medication straight into the penis, to the cylinders, and it works within seconds to give you a very strong erection. But again, a lot of black men, Nigerian men, when I talk about injection in penis, they say, oh, no, I don't want no wahala. They don't want that, basically. So then we can use creams which own the penis, which absorb inside. And you're just trying to get the medication into the cylinders to help with blood flow. Erections are all about blood flow. If that doesn't work, or the medication or injections don't work, then we're moving towards surgery. And the surgery involves insertion of prosthesis. So they're like two silicone bands which replace those, go inside the cylinders. And there's two types. So there's a malleable one where you bend up and bend down to use. It's not very good, and it works well, but it's not very sexy, and it's kind of cumbersome. Or I call it the Rolls Royce, which is a three-piece malleable prosthesis where you've got a pump which we put inside the testicle. We've got a fluid inside the abdomen, and basically you pump it to give the erection in the testicle. Once you finish, you press a button and it comes down. And that prosthesis costs about $20,000 a piece.
No way.
Make the drug now, so it makes it cheaper. And the side effects are headaches. So you can get swelling of the blood vessels, giving you really bad headache, nasal congestion, and some people can get chest pain, which is dangerous. So if you got chest pain whilst taking Viagra, it could cause a heart attack. So you don't want to have sex and that's the last thing you have in your life, dropping dead. So that's why it's important to have.
I think there are cases of people who actually drop dead in the case of sexual activity.
Correct. Yeah.
But you're saying this could be linked to it?
Correct. Yeah. If you have heart problems and you take Viagra, it can cause heart attacks. So that's why it's important. Yes, doctors can do the prescription, or a pharmacist do a health question. And if you've got any problems of chest pain or heart problems, they will not give you the medication. What I do not advise is people to just go on the internet and buy it without having a health screening.
Wow. The next question I have here is, someone said, I have lost my libido, right? And I am 35. What can I do?
Yeah. Well, I'm sorry to hear that, because obviously at 35, you should be at the peak of your sexual prowess, basically. So it's very upsetting as a man when men don't feel they can do things at that point. So loss of libido is loss of sexual interest. So you may have a partner and she may want to have sex and you're just not interested anymore. Stress, anxiety. Number one thing we do is check your blood hormone called testosterone. Testosterone is a hormone that makes men men. It gives you a beard, grows hair on your chest. And some people have a very low level of testosterone. As you get older, that level drops anyway, naturally. But in younger men, some men have a very low level, especially if they've got medical condition where the hormones are in imbalance. So I would do an early morning testosterone to check your testosterone levels. If the levels are low, we can give creams to try and boost your levels to try and keep things topped up again. And a lot of men, some men go to the gym and say, I don't have much muscle mass, my energy is very poor. We check the testosterone is very low and we can replace it simply and easily and get them back on track. Some men, yes.
Yeah, I'm with you. Go ahead, sir.
Yeah, some men have a condition where the testosterone is very, very low, dangerously low. And the reason why testosterone is important, apart from sexual function, it helps with bone health. So if your testosterone is low, it means your bones are weaker and you're more prone to fracture, breaking bones, and also having cardiovascular problems, so heart attacks and strokes down the line. So testosterone is very, very important for men, which is very different to the testosterone that bodybuilders abuse when they inject testosterone. It's slightly different because you're normal then and you're boosting your levels, which is dangerous. Right. If you're low, you need to bring the levels to normal.
Okay.
Yeah.
But then when you're normal and taking it high, then
that's dangerous. Yeah. Because if you have too much testosterone in your body, your testicles that produce the testosterone shut down because it thinks you've got too much. And that's why men that abuse steroids can get small testicles, because you produce too much, your body shuts down and the testicles shrivel up, and that can affect your fertility.
Oh my God. Now that's an interesting picture you've given us in the head. So no matter how buff you are in the gym, there could be a problem with all the people taking the steroids and everything.
100%. And I see a lot of men would have, down the line, they abuse steroids, they get the gym body, but then when they're trying for a baby, 2-3 years, nothing's happening. And it's because they've abused steroids, they've shut down their testicle and testosterone production, which means the sperms don't produce.
Wow, this is so. I wish, honestly, this information can be louder than it is just in my small live IG, because you're saying a lot of important, very important, delicate things that should be really out there. People should know. Just to be sure, when you say libido, you mean interest. That's what it means
Correct.
in men.
Interest, activity, interest in sex, stimulation, activity, just things just not working. It can be linked to erectile dysfunction as well. So men that have low libido can have poor erections, and actually treating the testosterone can be one way just to get the erections back to normal again. It may not be a blood vessel problem or anxiety problem, just a very low testosterone. You check
so it means at some point men can have high libido and have low libido. Still they're normal.
Don't
So it
forget,
means at some
testosterone is a
point,
diurnal
this month they can
variation.
be very happy, another month they can be less happy. So it has a lot to do with emotion and desire.
Correct. But for men, remember that, well, some women will know that men are very more interested in sex in the morning. That's because testosterone levels are highest first thing in the morning. So
I
all
didn't
those
know this.
ladies, remember,
And
if
you
the guy is
tested.
interested, you know why. His testosterone's through the roof in the morning. By the end of the day, at 9, 10, midnight, the testosterone levels are very low compared to the thingy. So sometimes partners need to understand that. So they have sex, and after busy days, they're both working in the office, stressful, they put the kids to bed, and then they try and have sexual activity, and it's not working, and they just don't understand why. And then I say, and they have psychosexual counseling. They say to them, maybe have sex first thing in the morning, and they go, wow, this is the best thing ever. That's because his testosterone is through the roof in the morning, high, naturally. Yeah.
There was a question that came in as you were speaking. I think, if I'm right, it says, does vasectomy affect erectile dysfunction? I'm not sure. Let me check if that's the question.
That was the question. Yeah. So so
Does
vasectomy.
vasectomy affect erection in any way?
No, it does not. So vasectomy, for those that don't know, is a procedure, surgical procedure, to basically have a form of permanent contraception for the man. So I explain what it is. So imagine you've got the testicle here, you've got the ball of the testicle, and you've got a sperm tube called the vas deferens. So during sexual activity, the sperm comes out through the tube and comes out through the penis. By a vasectomy is making a gap in that tube and so that sperms can't come out, basically. And it's a permanent form of contraception. Very common. I do those procedures in the office. It's not a general, you don't need anesthetic. It takes 20 minutes, local anesthetic, and you're out in the same day. It should not affect erections. I'm not going anywhere near the nerves or anything else. So vasectomy does not affect erections or sexual function. It should not. Separate system.
Wow. Okay, so the next question I have is this. Someone said, I have a bent penis. Is this normal?
Yeah, that's a very excellent question. So no man is like this, 100% straight. Every man has some degree of bend and rotation in the penis. That's normal. That's what God gave us. What is abnormal is this. So imagine having a penis where there's a 60, 90 degree, 70 degree bend. You cannot do anything with that. That condition is called Peyronie's disease. Okay? So what happens is that you get plaque formation, inflammation in the penis, which on the underside, which causes the penis to bend on the same side. So if you've got inflammation here, it shrinks and bends. This side is normal, and it bends and it bends. There's two phases. There's the active phase where the penis is very painful, sex is very painful. And then there's the chronic phase after a year where it just stays in the position and it can get worse. So that's called Peyronie's disease, and that's a bent penis. What I advise first in the first instance is that we can give medication to try with creams to try and reduce the plaque, the inflammation here, number one. Or we use male extenders, which are, we'll talk about it later, but devices that try and extend the penis to try and disrupt the plaque. And that can give you a good degree of angulation to get going again. In some men where this doesn't work and it's still like this, then we do surgery called a Nesbit's procedure, where we basically strip the penis down under the skin and put stitches on this side to correct. Can you see if I put stitches here to tighten, it corrects. However, for every 30 degrees you correct, you lose a centimeter in length of the penis. So it's very important to explain to men, you'll be straight, but you'll be a bit shorter. So you have to very counsel men, because no one likes shorter.
That's right.
But if it's like this and you can't have sex, I would accept personally a shorter but straight than bent but long, because you can't do anything with that.
Yeah.
That's called Peyronie's disease. Peyronie's disease.
We're having more questions coming. Someone say, hi, doctor, can vasectomy procedure be reversed?
100% yes. So I do a vasectomy. I always say to men, it can be reversed. I had a situation where a man had a vasectomy, his first partner. She unfortunately passed away. He found a new partner and wanted to reverse a vasectomy. A vasectomy itself takes about 30 minutes to do both sides. To reverse takes about 3 hours. The reason is because you've got a very fine tube, which you have to put together. And that can take 1 hour to do each side because you've got a tube on each side. But the longer you leave it, the worse the outcome. So if you've had a vasectomy and you wait more than 10 years, the risk of successfully bringing it together reduces. So it can be reduced, but it's a more painstaking. And in that situation, if you're trying to have children, it's easy just to take sperms from the testicle for fertilization than trying to join the tube up.
Wow, we're having a lot more questions coming in, but let's see. Somebody said, no, actually, it's a question that says, do Chinese medication, local medication, because that's a very common thing here. People sell things to carry, funny things in their head, and they tell you, drink this, come on, things like that. So do these things work? And is it healthy for men to actually go for options like this?
The problem with Chinese medication is we have absolutely no idea what the levels of drugs in there. So some people swear. I see Niger guys who come and say, I take this China medicine and it's brilliant. I'm going for hours. The problem is we don't know what's in them, number one. Number two, I've said to you before that a prolonged erection can actually be dangerous. So men think, yes, if I can go on for 4 or 5 hours, I'll satisfy my partner. Actually, you're doing damage to the blood vessels in your penis and can cause irreversible damage. So, and we don't know what's in the drug as well and the side effects. The drugs that have been examined, like Viagra and Cialis, we know they're predictable. The Chinese medication, they have high levels of the drugs, but they're unpredictable. So one day you take it, you feel great, and it works. You may take it another time and have a prolonged erection that lasts 5, 6 hours, which is dangerous. So I'd never advise Chinese drugs because we just don't know what's in them and it's not safe.
And this same goes for the normal mixtures that you have. You see this thing, they're like sticks inside, they're like local herbs.
Yeah, again, with local
herbs. Like herbs and things, they bottle them, they carry them around, and northern women, it's a very northern thing, and they sell this thing. So would you say actually that, that it's actually good for men to go for this kind of medication? Okay, Bakasi. Thank you.
No, this is the problem. This is the problem. People don't understand. Chinese medication, we do not know what's in them. You're taking a chance when you're taking this. You don't know the amount of the drug of active ingredient, which is the phosphodiesterase inhibitor. We don't know the dose. You could be taking 10 times the safe dose. So yes, it's giving you a powerful erection, but men don't realize if after sex, the blood should come out the cylinders. If they don't, you're causing irreversible damage to your penis. If you take that Chinese drug every Friday night when you're out chasing out in the clubs and stuff, you're causing damage down the line and you won't know it.
Wow. This is excellent. Someone said, I have been trying for a baby with my wife for 2 years. Nothing has happened. Is it me or is it with her?
That's an excellent question. So traditionally and culturally, most people blame the woman. They say, she's not fertile. She doesn't, it's her. 60% of fertility problems are men related. I'll repeat again. 60% of fertility issues are not a problem with the woman. They're the men. 60% of fertility issues are male related. So what happens? A traditional scenario is this: and infertility means trying to have unprotected sex for more than a year and not conceiving. So if you've had sex for 9 months and nothing's happening, and you go and see a doctor, they're saying that's not fertility. You need to wait a year. That's the medical definition. So women will blame themselves, get upset. The family, the mother-in-law, the family will blame the woman. She's not fertile. She has all the investigations. She sees a gynecologist. She has her ovaries scanned, her womb, her hormone levels. They're perfect. You do the man and you do a scan of him or examine him. He's got small testicles. His testosterone is low. His hormones are imbalanced. You do a sperm count and his sperm levels are low. These are all things to do with male fertility. What's causing it? Alcohol, cannabis, drugs, male stress, tight trousers, men that wear tight trousers for a lot of this can all affect your sperm health, basically. So as a urologist, they see me for male fertility, and we have to try and work out what's causing it. Is it a problem where you've got a blockage, so the sperms can't get out? Or is it that you're not producing enough? So the tube is fine, the tunnel is fine, but the car's not coming out. Or is it that there's a roadblock in the tunnel and the cars can't get through the roadblock? Does that make sense? That's pretty much the basics of male fertility. Sometimes it's a production with the cars. You can't produce enough cars because the factory's not working properly. The hormones is not working. So 3 is either the hormones aren't working, the tube is not working, so there's a roadblock, or the cars aren't moving fast enough, or not enough of them. Yeah.
Wow. Someone said those tight trousers have an effect.
100%. So the testicles lie low for a reason. The reason they lie low is they allow them to cool. If testicles become hot, the sperms aren't happy and you reduce your sperm production. So after ejaculation, it takes about 20 days for sperms to regenerate again, to fully. But if the environment's too hot, the trousers are too tight, or the underwear's too tight, the testicles become hot and your sperm production isn't very good. So I always ask men, what kind of underwear do you wear? And they look at me funny, like, why are you interested? It's very important for men's health to have good supportive underwear that's not too tight, trousers not too tight. Again, men that work on their laptops, so you see a lot of men will work on their laptops, on their chest, on their trousers for days and days, and that can damage sperm production as well, basically.
My goodness.
Yeah.
So there's a question that has been coming up repeatedly. So I want to get that question. Just a second. Okay. Can you please share your knowledge on HPV? Please. Thanks.
Yeah. So HPV is called human papilloma virus. It's common around the female cervical area. And we know that increased levels of human papillomavirus can cause cervical cancer down the line. In many countries, and in the UK now, they've started screening for this and offering a vaccine for younger ladies. The reason why human papillomavirus is important for women is it can cause cervical cancer. In men, it can cause oral cancer. So it's very important to try and eradicate the virus to reduce your risk of cancer in the future.
Wow. Okay. So this is a question that also came up. It's a bit long, so I'm going to read it. My husband has never had any difficulty in getting it up, but recently I noticed he struggles to. It would take a while, but eventually he will. I didn't comment on it, but I encouraged and helped him. But lately, that's not working at all. He says he has a lot on his mind. We have gone to see a doctor, prescribed some medications, told him to exercise and rest. However, it's been 2 weeks now, but nothing has changed. He is in his early 40s.
Yeah.
What do you advise?
So this is a very common scenario with men, high-flying men in their 40s, busy lifestyle, busy job, fast-paced, rushing around. This can all affect your libido and your sexual interest. In the first instance, I would want to take a detailed history and find out exactly what's happening in his underperformance. Is it premature ejaculation where he's finishing too quickly? Is it that with stimulation, nothing's happening? Or is it that they have a big argument and they try and resolve it and there's a couple issue? So I'm trying to tease out, is it a physical problem with the cylinders? Is it an emotional problem with him and his partner? Or is it a psychological anxiety issue? So you try and identify by certain questions which one it is. For example, I'll say to him, if you go on holiday, do you have good erections? Yeah, fantastic. Another thing to mention is early morning erections. That's a telltale sign there's a problem. So all men, no matter what age you are, from young boys to older men, can wake up with an erection. Once you start to lose that, that tells me there's a mechanical problem. And that's the first telltale sign. Loss of early morning erections is a problem.
Wow. Okay, so there's a question here. I'm going to read it out to you. Hey, doctor, what about varicocele? I think that's it.
Yeah, varicocele.
How does it impact on infertility of men, and how can it be treated?
So, yeah, that's an excellent question. So varicocele, again, this is the testicle. You've got the blood supply to the testicle arch, and then around the testicle, there's a series of blood vessels called veins, which help cool the testicle as well as having the position. Those veins have valves which allow blood to leave the testicle. But when those valves can become incompetent, and rather than the blood being like a one-way street leaving, it becomes a two-way street. So blood can go back in, and it stretches the veins, causing something called a varicocele, which can sometimes be very uncomfortable and painful, very common. And when you feel your testicle, you feel like a bag of worms. Very painful. So the reason why the link with fertility is we know that if you do not treat varicoceles, it can affect your sperm count. So men that have problems with fertility, we do a scan of the testicles and found varicoceles. We treat those and we find their sperm parameters improve. So it's very important to treat varicoceles in the context of fertility. And it helps boosting your sperm numbers because your testicle is not having the normal mechanism of the blood leaving and cooling it. Does that make sense? So it's very important to feel varicoceles. They can feel like worms and very painful, tender. The most common symptom is testicular pain at the end of the day. So you've been standing all day with your feet or working around and you complain of a dull ache in the testicle at the end of the day. That tells me it's a varicocele because the blood's been pooling in the testicle and stretching it.
Okay, so we're supposed to have started at exactly 5, but something happened. So we went off and came back online. So I noticed that these sessions are 1 hour, okay, and then Instagram shuts off and goes back on. So guys, if this shuts off, please know we'll come back online as we're going. So should this live go off in another 10 minutes or so, we'll just go off and come back on. So now the next question, which is the big question I know so many people want to hear is, doctor, can you actually make a penis bigger? So can you give a man inches? You give him size. What can you do in terms of size and I think length and size?
Okay, I'll answer that question by telling you about a study. At King's College Hospital, my colleague, one of my colleagues, Dr. Mio and his team, looked at 50,000 men across the world and asked them about their penis size. And basically, we found out that they looked at penis size and got men to measure their penis. The biggest study in the world, done about a year or so ago. And we found on average,
50,000 men. That's
a lot of men across India.
For that as well.
You'd be surprised. So we basically, so they looked at it and they found an average penis length is about 5 to 6 inches erect. Average. Some men are bigger and some men are smaller, but on average, that's about it. And circumference, the diameter across, is about 3 to 4 inches, and that's normal. However, we then did a second study where we asked men, based on the length, do you think you're normal or abnormal? They didn't know what average was. And the vast majority of men thought they were abnormal when they were absolutely normal. So it just shows men are obsessed with their penises and the size and always worried about it. There is a condition called micropenis, where your penis is less than 3 inches. That's a congenital problem. So remember I told you testosterone, the hormone that makes men men. If you lack in testosterone from birth, you don't get normal penis growth with the testosterone, and you can get a condition called a micropenis. That's a problem. That's a congenital issue you're born with, and that's why testosterone can be impactful. So that's the only reason why we'll get involved. The vast majority of men, 90% of men, are absolutely normal, but everyone's obsessed with length and want to be longer. But I can explain the type of surgery that is available and explain why it's probably not a good idea. So there's 2 types of surgery. In the UK, a lot of people, in some countries, they do penis expanders. So they use silicone and inject it straight into the tubes to give you length. However, you're injecting a foreign body into your penis, and that can cause damage to the penis and also damage to the blood vessels if you inject into the blood vessels, damaging your erection. So yes, you'll have a longer penis, but you'll have no erection. So that's useless, isn't it? The second one is that the penis is attached to the breast, to the bone at the base of the tummy there. So by cutting the ligament or extending it, you can get some length, but you're only ever going to get about 1 inch or so. These myth of extending it by 2 or 3 inches is a myth. No one can ever do that. And if you put expanders into your penis, you're going to destroy erections permanently, and it's not going to work. So, be careful what you wish for.
Wow. Because I mean, there's a lot that is going on aesthetically around this right now. I discussed with a colleague earlier in the week, and when we're talking about it, we were talking about there's actually people, there are fillers now. Men are beginning to receive fillers to get bigger, and longer, so it's a whole side of aesthetics that is becoming a thing and exploring on it. So it's quite interesting that your research has actually given a very strong. I wish men could actually trust themselves better.
Exactly.
Trust me, women, we're actually fine. It's a psychological thing. Now I have this question. Someone said, my husband's father died of prostate cancer. Now, should we be in worry? Do you think my husband would be, would be at risk?
Yeah, 100%. So let me just go back to basics. The prostate gland is the size of a walnut. So imagine you've got the penis here, the prostate is inside the bladder, and then you've got the bladder here. Okay, so the entrance between the bladder and the water pipe, in between, as the prostate gland. The prostate gland is a sexual organ, so it adds, during ejaculation, it adds volume to sperms, and it helps the sperm to move. As men get older, that prostate gland can swell up. And imagine your bladder is a pump, and the prostate gland's a tap. As the prostate gland swells, the tap becomes tighter, so the pump is working really hard to get the urine out. And that's why men have problems with urination and the flow. They're waking up 4 or 5 times a night to pass urine. They get infection and bleeding. That's prostate growth. The prostate can grow normally or abnormally. And abnormal growth for that gland is cancer. And that's what it is. As a black man, our risk of prostate cancer is 10 times compared to Caucasian men.
No way.
10 times, exactly. And
No
if
way.
you have a family history, so your father had prostate cancer, or your brothers have correct, and your father or brother have prostate cancer, your risk is significant. So, for example, my father had prostate cancer in his 50s. So I'm black, and my dad had prostate cancer. He's Nigerian. My risk is high. So what we advise for these men and black men is from the age of 40 to start having a blood test called PSA, which is called prostate specific antigen. And that tells you about your prostate health and what your levels are. And that will guide you into whether you may or may not have prostate cancer. So I recommend from 40, every 2 years, get a PSA blood check from your doctor. It may save your life. Prostate cancer is a silent killer. In the early stages, you may have no symptoms whatsoever. You feel absolutely fine. You do a blood test and your PSA is high. And that's the only first time you had a problem. Festive of having waterworks problems and bleeding and not urinating a lot. But most men have no symptoms at all. You only get symptoms when it's cancerous spread. And it's too late then.
Wow. Guys, I don't know if you caught that. You said for black men, you are 10 times
Risk is high.
or at risk of prostate cancer. That is actually a shocking number. Now, there's this question that is out here.
I was going to say one final thing. We looked at worldwide statistics on prostate cancer, and Nigeria, the rate of prostate cancer in Nigeria is Nigeria's top 10 in the world in the rate of prostate cancer, because we know. Well, we think that it's probably due to testosterone. We're not sure genetics why black men have higher rates of cancer, and also black men die because of cancer. There's some types of prostate cancer that is very slow growing. It won't kill you. We treat it by watching it. But in black men, they tend to present with more aggressive cancer that spreads. And Nigeria is in the top 10 in the world in incidence of prostate cancer. It's a big killer in Nigeria.
Wow. I have this question that is here. Please, I would like to, guys, don't forget, if this video goes up, we're going to come back right online.
If you want me to continue talking.
Please, doctor, this is very, very, I mean, you've been amazing. We can't say thank you enough.
Thank you.
Is the risk higher with certain body weight size?
Yeah.
Does it have any link with STDs? Does it disproportionately affect people of certain race or sexuality? You've answered a bit of that. And is it hereditary? We've also answered parts of that. But now this is body weight, size, and does it have anything to do with STDs?
Correct. So the risk factors for prostate cancer, we talked about age. So if you're older, you're more. So if I took 100 people in the 80s and investigated them for prostate cancer, 80% of them will have cancer. Does it mean it's going to kill them? No, because they've lived so long through their life. They die with prostate cancer rather than from prostate cancer. The issue is the younger men who have a potential cancer. They're the ones I need to find. So I talk about cancers being pussycat or tigers. Is your cancer going to be a pussycat, which means it's not going to do much, it'll just bumble along in your body? Or is it a tiger that's going to kill you? And that's where the job of the urologist is to investigate with blood tests, scans, maybe doing a biopsy as well. Obesity is a big risk factor. So if you're larger and bigger, your risk of prostate cancer is increased. We think, again, it's because of testosterone, that hormone, testosterone levels that act on the prostate and can cause rapid growth of the prostate. Any cell that divides rapidly is at risk of turning into cancer, be that on the skin, near your vagina area, in the prostate. Any cell that has a rapid turnover means your risk of cancer spread because it's moving around quickly.
Wow, that was an excellent question. Now, yeah, please, why is it high? Why would you say prostate cancer is high in Nigeria?
Well, it's high in black men. So whether you be that in Nigeria or in USA, the rate of prostate cancer is higher. I think in Nigeria, it's a number of factors. Number one is access to healthcare. If you've got problems urinating and you're in some village somewhere, you may not know what's going on. You may take Chinese medicines and try and treat yourself until things are really advanced. And then you see a doctor, and then you found that the cancer's already spread. So it's partly access to healthcare. It's partly understanding education. So men don't understand what prostate is or what the PSA is. So that's another thing. And number three is genetics. So we know black men are genetically predisposed to having higher testosterone. And we think that's the reason why prostate cancer is more prevalent. But we don't know. I'll give you an example. But also environment plays a massive factor. So Japanese men have the lowest risk of prostate cancer anywhere in the world. We know that. But you take that same Japanese man and move him to the United States of America, his risk of prostate cancer becomes like everyone else high. It must be more than just genetics. It must be environment, diet, right, exercise, which things that Japanese men are very good at doing. But in the West, we're very poor. We live a sedentary lifestyle. We don't exercise. We eat poor foods. And that's where diet and genetics combine together.
Wow. So there are certain foods. Do you think there's certain medication? What would you advise the lifestyle of a 40-year-old from now to start to work against this?
Well, I've just seen a question asking someone, does regular sex reduce the risk of prostate cancer? Absolutely. Let me say it again. Regular sex reduces your risk of prostate cancer. The reason being is that someone asked, I can see you asked a question, so I was going to answer it directly. Remember we talked about during sexual activity, the sperms coming out of those tubes? Sperm's life cycle is about 20 days. So you want to get rid of those tubes and clear out the system. So there's some studies that show that men that have regular ejaculation, it reduces your risk of prostate cancer. We're not sure why, but we think it's probably because you're clearing out the system and you're moving those sperms in the testicle out and clearing things out. So men, tell your partners that if you want to help me with prostate cancer, we have to get it on now.
Let's have more. Wow. Yeah. That's interesting. Okay, I'm on the next question now. So what would you say are the early symptoms of prostate cancer?
So in the early stages, as I said before, you may get no symptoms. Some men complain of poor urination, so the flow is just not good what it used to be. And the good question I ask men is, when you're a young man, you can pee at 20 paces in a good stream. But when that stream starts to reduce and slow down, number one. Number two, you're that guy who always go to urinal and is there longer than most people. So we've been into a club and we've been taking a urination, and there's always one guy who's just there for ages peeing. That could be a problem. Waking up at night. We should not be waking up at night to urinate. Some people wake up 4, 5, 6 times a night to urinate. Some people get infection or blood in the urine. These are things that can be a telltale sign of a prostate problem or cancer.
Wow, that's actually very easy indicators. So it's just men, you just need to pay attention to yourself, literally.
Exactly.
Which is the thing. Men feel being tough is being casual with every aspect of your life.
No.
But just monitoring these things could actually be a lifesaver. Like
absolutely. So I'll give you an example. I see a lot of men. I work at the Shard, which is the tall building in London, central London. And I saw a chap from Nigeria who came to see me. He had a PSA of 10. So a PSA, the blood test, normal should be between 0 and 4 or 5. He was in his 50s, his PSA was 10. I said to him, look, you've got a raised PSA. It could be cancer. We need to investigate. He said to me, Oga, I've got to go to Lagos. I'll be back in 3 months. I'm very busy, living a busy lifestyle, very important businessman. I begged him. I said, look, stay, let's investigate. He said, no. He went off to Nigeria, came back. I saw him again. His PSA was 50,000. His PSA was 50,000. In 3 months, it spread. And at that point, we did a scan and the cancer spread all around his body. He died within 6 weeks.
No
so
way.
The point is that whenever there's a problem, it's always good to, if you alert early, get it dealt with early, you could cure and save people's lives. If you're stubborn and don't want to listen and go off, and things get to the point where they've spread around the body, there is no doctor in this world, no matter how much you pay them, that can cure you. and it's a death sentence. So get
Okay,
checked, men,
so
get checked
Instagram
early.
is telling us now we have 2 minutes. It's counting down for us.
Yep.
2 minutes to wrap up this session.
Do the people want me to
Guys,
continue? Is this useful, people? Give me a thumbs up if
of course.
it's useful.
Guys, give a thumbs up if you want Doctor to come back, please. We still have a few more questions to give him. It's counting down 39, so it's about 2 minutes, 1 minute 30 seconds to go.
Okay,
So we
I'll see
have
some.
a lot to talk about.
I see some thumbs up, so we can keep going.
P.Shot.
I'm happy. Yeah, let's do that. Okay, shall we?
We still have the questions on P.Shot.
Yeah, no problems.
So I was also going to ask, how do men, is there like a screening for men for prostate? You know, like women, there's actually a screening. They go for, I think every year from a certain age. But for men, how can they screen to know if this is, you know?
That's a brilliant question, and there's a lot of thumbs up. Shall we? I want to get into that question. So should we come out and come back in?
Okay, guys. So let's wrap this up. We're going to have to go and come back. It's already an hour. Thank you for staying tuned in. So we're going to just end this live and come back, and we can wrap up the session. Yes. Yes. Right, guys, so we're tuning back in where I'm sure Instagram is beginning to send out the information to let everybody know we're back on. It has been an excellent, educative, amazing session. Honestly, this should be out there. Men should know and be aware of what's happening. I mean, it's interesting. Okay, doctor is here already, so I'm going to just add him now. It's interesting to know that, you know, men are the ones asking this question, while in fact it should be men asking these questions. Your life is as important to you as it is important to us, as your wives, your sisters, your daughters, your friends. You know, we're waiting for doctor to join back in. It says waiting for Jonathan. So he's going to come back on. It's been usually our sessions are 1 hour and we're done. But you can already see that today we are crossing over it. So it's still waiting. Doctor, if you can hear me, it says waiting for you to join in. So please, if you have questions you had asked in the previous live, it's okay to ask the questions again so that we can revisit it. Doctor, it says waiting for you to join. Guys, I hate when this happens. Ugh. I hate when it happens, but yeah, let's see. There's some questions I can see going on. Is circumcision in older men a good thing, and is it safe? Okay, we're going to have to ask doctor for these questions when he comes in. Okay, so it's again waiting for him to come back on. You guys have been amazing today. Thank you for being patient and joining and being active.
Hello.
Yay, doctor, you're here.
We're back. We're back. Yes.
We're back. Okay. So we were discussing. The question was, I think we're talking about screening. Yes.
Yes, screening. Yeah.
So we're talking about screening. Women have an early screening. You know, you can have a mammogram to check for female. Is this option available for men?
So in my clinic in the Shard, I offer, it's called an executive physical for men. What that involves is a full health assessment. So we get real deep into cardiovascular. We talk about erections. We do questionnaires and surveys. We then do a semen analysis. So you can have your sperm analyzed to know exactly how good your quality of sperm is in terms of the movement and the strength and the type. We check your PSA, your cholesterol. We do a screening of your heart to check your heart. It's a full MOT, a full workout of the man. And we do something called a flow test. So we get you to urinate into a machine to measure how strong your flow is. I do a scan of your kidneys, your bladder. So I really do a full health screening, a complete once-over of men, basically. And this just makes sure you're in tip-top condition. We identify any potential issues. We can treat them before they become a problem. So yeah, so I'm a big fan of men screening. We should do enough of it. We're not doing enough. So I'm trying to send that message that men should be screened as well. And it just keeps you in good condition, basically.
How
And it's
often should men get this screening? I mean, you
every
mentioned
year.
earlier from your 40s, this should be a
Yeah.
thing. But
But
how
even
often is it annual?
ev
Is it, you know,
for men,
biannual?
I see a lot of younger men in the city and in Canary Wharf. I see them maybe once every 2 years. But once you hit 40, then the risk of things going wrong is higher. So maybe once every year, we check the PSA blood test. We check your cholesterol. We check your heart. We check your waterworks system. We check everything. Make sure things are in tip-top condition, basically. It's called an executive physical.
Doctor, what's the meaning of PSA?
So PSA is called prostate specific antigen. It's the blood test that we use to determine your prostate health. PSA is released from the prostate gland, and it's an indication of a potential prostate cancer. So a man in his 50s, a PSA between 0 and 4.5 is normal. Anything above 4.5 I don't say always is, it may indicate cancer. So it will require further testing. I'll check your urinary system. We'll do an MRI scan of the prostate. And unfortunately, it does involve the dreaded finger, which a lot of men do not like. They do not like me putting my finger in your back passage. The reason I'm doing that is to try and feel the prostate gland to make sure it feels healthy. And it takes 10 seconds. It's not gay. It's over quickly, but it causes men a lot of stress. But that's what we do as part of the package.
It doesn't sound very comfortable.
It doesn't, but it's quick, and it's my job to reassure you. We do it quickly. It's over with. It's not a gay thing. It's a medical examination, and we're done. Move on with life. And
How
people don't.
expensive is this?
It depends. So in London Bridge Hospital, it depends on the level. So you've got a full executive physical, which can be in excess of £1,000. That's for the senior executives. But anything between £200 to £500 is enough to get the basics done. Sometimes you don't. I see you for a consultation, and I give a treatment recommendation. You can go back to Nigeria and get the labs and the things done. It doesn't always have to be in England. I've also do video consultation, so I don't have to come. We can do a video consultation like we are now. I give you a very detailed treatment plan to follow. I recommend places in Lagos or Abuja you can go to, have your blood test, and then we meet back again for another video consultation. So it just means that we try and improve and streamline things for men, and it means access is anywhere. You don't have to come and physically see me in my office. I can come to you.
Excellent. Guys, I'm sure if you tuned in at the start of this, I did mention that Dr. Jonathan is not just, you know, a doctor I reached out of the blue. He is actually a family friend. I'm very, very privileged to know you.
Thank you.
Beyond this live video, you know, we are actually projecting to have him, you know, visit and be at Hello Perfect towards the last quarter of the year, all things being equal. And if you do want to see him, it's okay to start now to book appointments. And he is here. You can see his handle. We are not holding him. Please reach out to him directly. If you have any questions directly, send messages to him. He is very happy to help. But when he's in Nigeria, he will be operating out of Hello Perfect, and you can schedule appointments. Please know that we are 100% discreet. You know, we are very, very discreet with you. And if you are absolutely not ready to have your consultation done in the clinic, it can be done privately within your own provided space. Of course, it's you know, you just have to work out the logistics with us, and we can also have that with you. Doctor, there is a whole side to this, okay? And there's a new rave. You know, I've been at the clinic, you know, even when I was consulting for other clinics, and some men have come in, and the question is, I want to get a P.Shot. So again, I would want you to please tell us what P.Shot, what is it about? I know there's O-Shot for women, there's P.Shot for men. Can you tell us a bit more about P.Shot? And we have questions lined up for that as well.
Yeah. So the P.Shot is basically a treatment that was found in the United States. And basically what it does is this. The doctor will take blood from your arm, so draw blood. And inside your blood, there's different types of cells. So you've got red blood cells and you've got plasma. And within those plasma, you've got certain type of stem cells. Stem cells are cells that can turn into any kind of cell in the body. So they're very valuable cells. So what happens, the theory behind it is that you take the blood from yourself, you spin the blood down so it separates. So the red blood cells go to the top, and at the bottom of the test tube is plasma cells, which are white. Those plasma cells get extracted and then they get injected directly into the penis, with the theory being that it helps produce stem cells which can help with penile regeneration, help with erections and penile growth. So that's the theory behind the P.Shot. The O.Shot is the same theory, so the same stem cells, but rather than inject it into a penis, in the women, they're injected around the clitoris. Again, it's meant to help with improved nerve endings and sensations.
So, does it work? That's the first question.
The jury is out for that. I'm not going to say it's 100% effective. The treatment is very expensive. I know in the United States, you can pay up to $2,000 for an injection. I'm always honest with people and saying, look, there are alternatives, more conventional methods that we should try first. I would never go straight to a P.Shot because there are other things that could work. They also use the same kind of technology in men with, or people who have knee problems, in restoration of the knee joints. And the evidence is brilliant for that. For the penis and for erections, it's still limited. So I'm always honest with people saying there is a success, there's a failure rate with this. It's quite an expensive treatment. And it's probably better to try the other conventional treatments first. And if those don't work, or surgery, you can't afford the surgery, then maybe the P.Shot is an option for you. But it's about being honest and upfront with people.
Have you done this procedure at all?
Yeah, so I practice in Bermuda as well, in the Caribbean, and we do treat men with the P.Shot, and we do the O.Shot in the Caribbean. Yeah, I'm not sure it's available in Nigeria yet. Is that something that's there?
Yes, it is available. You know, again, it's a very discreet procedure, so not a lot is being said about it. But yes, you know, it is a thing. In a consultant, I have a doctor actually that, you know, I go to his clinic sometimes in Abuja, Dr. Dan Malan. He's a very popular doctor. But beyond the O-Shots, which I've seen him do a couple of times, he also combines it with laser. All right? Women swear by this.
Yeah.
A lot of women swear by this based on the fact that, you know, the O-Shot, which is again the PRP, which is in the blood, is being administered to the woman, and then laser is inserted to generate live, you know. So and for women who have urination, what do you call that now? What is it?
Incontinence.
Lack of cough and pee, incontinence.
Yeah, yeah.
So they also say they work amazing for them.
Yes.
So someone also was asking is how no, let me check. This question came up earlier. It says, okay, we're trying to find a question.
So in terms of the treatment you're talking to, that's the PRP combined with a treatment called Thermiva. So Thermiva is a laser heat treatment that basically, so in the line of the vagina, you've got cells called collagen, and collagen is what makes cells supple. So if you've got a good amount of, as you know, if you've got a good amount of collagen, that gives a healthy appearance. In the vagina as well, as women get older, they can lose the type of collagen in the line of the vagina, and that can cause some women to have problems with stress incontinence. So that means whenever you cough or laugh, you leak. Or urge incontinence means you get a strong desire to pee, and then that's associated by leaking, which is debilitating for women. And women are wearing 3-4 pads a day. It's a big problem. So some women opt to have everything tightened down below by having the laser treatment and the Thermiva with a PRP to try to tighten the vagina, help blood flow to clitoris, and improve their sexual function and their incontinence. So there is evidence that works.
Yeah, the question was, are there side effects to this actually? Would you say that?
Yeah, so it involves a needle. So if you're not careful, you can put the needle into the nerve and cause damage. You can cause chronic pain, labial pain, so pain around the vagina or the penis, because you're injecting the needle. So it's really important that the person that's doing the treatment is accredited and they can prove they've done many of these treatments. If somebody comes and tells me they've done 1 or 2, run for the hills. Do not have anyone with a needle near you, basically.
So injecting the PRP in the penis, for example, is fluid, all right?
Yeah.
So would you say this increases size and length for men?
So PRP does not improve your size or length. It's really the primary treatment is for regeneration of nerves and erectile function. That's very important. So injecting PRP, it's plasma, so it'll get disseminated in your penis and get washed out. So it's not going to affect your length of penis. The theory behind PRP is the stem cells help with nerve regeneration, which helps with erections. Okay, so very important. It does not increase your length.
Okay. One last question. We're beginning to round up, guys. I'm going to go back to your questions that you've written out here. Another long does this procedure last? Okay, doctor, is it my internet or yours? It's going to spin. Guys, if you can hear me, please wave in the comment section. Okay, doctor, you're here. So, how long does this last? PRP is plasma
rich protein. So just to explain, just to explain, PRP is a treatment where doctors will take a practitioner will draw blood from you, put it into a test tube. That blood is spun down, so spun at a really fast rate to separate the blood. So the red blood cells go to the top, and what floats to the bottom, and what goes to the top is plasma. And that plasma is meant to contain stem cells, which are cells that help regenerate the body. And those cells are taken out and drawn back into your penis or around the clitoris, with the aim being to help regenerate nerves and improve functions. That's what PRP is called, protein-rich plasma. Okay?
Okay, so someone said, how long does this actually last?
So there's studies that looking at PRP. In some people, it can work 3 months. Some people, 6 months, up to a year. But most people will say between 6 to 8 months is you have to have repeat treatment. So one of the disadvantages of PRP is that once you have one shot of it, it's rare that someone's going to not need treatment, subsequent treatments down the line. So it can get very expensive if you're having 5 or 6 treatments. So it's important to counsel patients carefully to make sure who will benefit from those, and make sure people understand that you have to manage expectations. It's not about one shot and then everything's going to work and you're happy. Sometimes you need 2 or 3 shots. Some people do work after one shot. So it's just about counseling the patient, make sure that they understand what's going on and you manage their expectations. That's really important with this time of treatment.
So, doctor, we're rounding up, and there's this question I really want you to look at answering. Someone said, can we talk about the sociological factors that prevent men from talking about these issues and seeking help? Most of the questions here, example, are from women.
So that's a really good question. I've done talks all around the world, and the vast majority of men's health talks are attended by women. So men are scared to come, or they hide in the background and ask questions. It's a taboo subject. No one wants to talk about problems of erection. Nobody wants to talk about problems with urination. You know, you get locker room talk. In Nigeria, there is no locker room talk. People just suffer. And it's only when things are hanging off, dropping off, or they're in a lot of pain is when they seek medical intervention. Often it can be too late. So the reason I'm doing these talks and trying to get out there is trying to explain to men of all ages, it's good to talk about your health. It's good to talk and and if knowledge is power, if you understand what's going on, understand what's normal, when things don't quite work, you can seek help early and get things treated. Women are very good. A small lump on their breast, something that's not quite right. They go and they talk to their friends, seek medical help. Men will leave it till it's growing, getting bigger, stressing them out, and then seek medical help. When often it can be too late. So I want to get that conversation going, basically.
Yeah, there was I wouldn't call it comedy or what, but something came out on the blog. Sometime this conversation started coming out, I think a year or within the last year, and it said that when you go in church and then or during prayers and then they're praying for infertility, you mostly find women who are coming out, and even during prayers they're always asking women, if you're looking for a child, please come out. It's interesting now to know that it is not a woman problem.
It's majority. They should pray for the men as well.
This is a very important thing to stress, that if women can understand that, it's not always your problem. You don't kill yourself over it. Yes, it's okay to do all you can as a woman to be there for your family, but don't kill yourself over these things. If you can have an understanding husband, please talk to him to see help, other than just having it in the house, and even sometimes taking out the frustrations on the wife. So Absolutely. There's a lot of psychology that goes into this thing that is just beyond this side of conversation, where men are not even engaging. And then you find other sides of it where mother-in-laws are on the wives to have baby, sister-in-laws are on the wives to have kids. The whole issue about birth seems to be on the woman. So it's an important thing for men to understand. It's okay you know, I think this year I'm going to actually join you in campaigning for men's health. Did you say it's in October?
Yes.
So
November.
November. So we have
Movember,
to
yeah.
mark that calendar hello perfect to tell men it's all right. You know, we want you to be alive. That's the most important thing. Be alive, you know, and know that these issues are not. It's not. I mean, guys, come on, doctor, tell them.
Health is wealth. Health is absolutely
Health
wealth, you
is
know.
wealth. Okay, it's been an incredible session with you, Doctor. Please, everybody on the comment section, say thank you. Thank you to Doctor. He has been excellent. He has answered
Thank you.
all our questions. Like I said, you can access Doctor after now. You can send him a DM if you have your questions directly, or it's okay to pre-book appointments. Hopefully, the world is normal soon. We can actually have physical access to him. If you do want consultations, we can organize that between the doctor and yourself. Guys, again, don't forget, Doctor is a frontliner. He is among the heroes of our time. He is actually fighting in the front line of health sector. Anyway, it's in the UK, but yes, my family is in the UK. So thank you, Doctor, for being our hero, fighting for us out there and taking out this time to be here. It is actually, we are very, very grateful. Guys, please say thank you to Doctor. He has been awesome.
Thank you very much, guys. And one thing I would say, just we've managed to do a whole talk and not mention about coronavirus, which is impressive. But one thing I would say for Nigeria, very important to practice social distancing. I know it's very difficult in Lagos with the traffic sometimes. And also make sure you wash your hands every time. Avoid touching your face and mouth because that's how the virus gets in. So I know that in Nigeria, you're about 4 weeks behind the UK. So very, very important that you do that for Nigeria. And we pray for Nigeria as well.
All right, guys. This video will be available after now. You can go back and rewatch it. Ask your questions. If I can't, I'll forward it to Doctor. It's been awesome. Thank you so much. And we'll see you next week. You know, you just don't know what next week will be about. So send in questions, or if you have any topic you think you want us to explore, let's see what our Sunday evenings will look like. Thank you so much. It's been awesome.
Thank you.
Thank you now.